In the United States, we tend to concentrate on data that are generated here, and perhaps do not look as often as we should at data from outside the U.S. Now, in the New England Journal of Medicine, researchers report the results of a prospective multicenter study of the French National Transcatheter Aortic Valve Implantation Registry, called France 2. The registry collected data from all transcatheter valve implantations performed in France and looked at death from any cause as a primary endpoint. The Edwards Sapien valve was implanted in about 2/3, and the remaining third of patients had Medtronic core valve devices implanted using the usual transfemoral, transapical, or subclavian approaches. The procedural success rate was an astonishing 97%. Rates of death at 30 days and 1 year were about 10 and 24% respectively. At 1 year, the incidence of stroke was 4%, and the incidence of periprosthetic aortic valve regurgitation was a disturbing 65%. In a multivariate analysis, a higher Euroscore, New York Heart Association functional class 3 or 4 symptoms, the use of a transapical transcatheter aortic valve replacement approach, and a higher amount of periprosthetic regurgitation predicted reduced survival. Now, this is a report of a real-life prospective registry in Europe, and the outcomes are almost identical to those in the Partner 1B trial, which randomized patients to transcatheter valve replacement or medical therapy, and also very similar to the Partner 1A trial, which randomized high-risk patients to surgery or TAVR. In those trials, the 30-day mortality was around 10% and 1-year mortality around 30%. At the ACC annual meeting this year, we learned that the U.S. trials are now showing that paravalvular leak, higher STS scores, and high New York Heart Association classification all predict worse outcomes. Sound familiar? That's what the France 2 studies show. It is comforting to see that repetitive data, registry or otherwise, probably represent the truth. I'm Peter Block, and this is a CardioSource Heart Minute.